Call it a transplant triumph for this Grand Rapids hospital. Spectrum getting the green light to move forward with a heart transplant program. 24-hour News 8's Danny Carlson's been following this story for weeks. She's live outside of Spectrum downtown tonight. Danny?
Well, Suze, that's right. Spectrum Hospital has been granted a certificate of need, saying that this area definitely has enough need to merit having a heart transplant center here. And they say there definitely is that need, and it's growing as our population ages. Now, in the past few years, they've had to refer nearly 20 patients a year to other transplant centers like Chicago and Detroit, and say if they could start doing heart transplants here today, they'd probably have about 19 or 20 patients ready to go.
I have patients every day that come up to me and say, please, when are you going to do transplant in Grand Rapids?
And now Dr. Michael Dickinson, director of heart failure at Spectrum Health, can say they will within 18 months.
This is the final piece of the puzzle. This means that I can look a patient in the face and say, come and see us and we can take care of you. If we can't take care of you, nobody can.
Already one of the largest heart clinics in Michigan, seeing more than 1,000 patients with advanced cardiac failure each year, Spectrum Health will now be able to perform both heart and lung transplants. They expect to do 9 within the first year of operation.
We're going to learn from the lumps that everyone else has taken, so we're not going to make the mistakes that other centers have made when they started.
Heart transplant patients typically have a 40-day hospital stay and then have to live nearby for months afterwards. So officials say not only will having a transplant center in West Michigan save local patients time and money,
the impact on patients' families is tremendous,
but will also offer a more economical option for everyone needing a transplant.
Coming to Grand Rapids, greater value when you look at the entire package, which includes quality, patient safety, and the cost of health care here.
And although they anticipate being able to provide world-class transplant service, the goal is to keep the same quality and care West Michigan has to offer.
Grand Rapids is a special place. I think that there are a lot of things that we want to keep in Grand Rapids here and not make them Cleveland or New York or San Francisco. We want to keep it Grand Rapids, and one of those is the personal care that in the relationships that we have with our patients. I think that that's just something that you can't put a number on, and I want to keep that here in Grand Rapids.
Now, Spectrum officials tell us they plan to perform 9 transplants the first year, and they actually have to perform at least 12 the second year they are in operation in order to keep that certificate of need. And they tell us since they already have much of the facilities that they need with their heart failure clinic here, the biggest expense left to start the transplant center is hiring a trained heart transplant surgeon. We're live in Grand Rapids. Danny Carlson, 24-hour News 8.